we have Alex Ionides, ophthalmic surgeon at Moorfields Eye Hospital here today. Alex,
Hello.
welcome.
Thank you very much.
Alex is also a co-founder at MTHK, and today we're going to talk about laser eye surgery. So Alex, tell us, what is laser eye surgery?
Laser eye surgery is a Lasik or PRK, so it's an excimer laser, excited diamonds, that reshapes the cornea to treat myopia, astigmatism, and some long-sightedness, which is called hyperopia. Lasik is the commoner one, laser-assisted intrastromal keratomelusis, and it's literally where, if this is the cornea, there's a flap created in the cornea by a femtosecond laser, then an excimer laser reshapes the cornea to treat the myopia at about 17 to 18 microns per diopter. So you need to have a thick enough cornea to be able to have the treatment done. And then the flap is put back down again and people are seeing by the evening. If people's corneas are not thick enough or are not safe enough, and we do scans such as pentacam scans prior to having laser eye surgery, there are other corneal scans that we use as well. And if they're found not to be safe for LASIK, sometimes people can have the PRK. That's just where we remove the surface epithelial cells of the cornea, reshape the cornea with the same excimer laser, put a contact lens on the eye heals up over 3.5 days, and the vision settles down over the next few weeks. So LASIK with the flap, you're watching telly by the evening, PRK at a much slower heal.
Thanks, Alex. What vision problems can be treated by LASIK?
Short-sightedness, so myopia, and astigmatism are the main two that are more predictable. Long-sightedness or hyperopia, that can also be treated by LASIK, but it's less predictable.
And Alex, with these vision problems, with myopia, is there a certain prescription within which it actually works and any that it doesn't work for?
With the higher myopes, when -7 goes into -8, -9, and certainly by -10, most ophthalmologists would be thinking of a different kind of treatment, perhaps implantable lenses, ICLs, implantable Collamer lenses, and not doing excimer laser.
And is LASIK safe?
Yes, LASIK is safe. If the cornea and the preoperative scans all show that the cornea is suitable for LASIK, then it's perfectly safe to have it done. The worst complication that can happen from LASIK is ectasia, where the cornea is made too thin and then the cornea starts to bulge, just like a wall of a football or a beach ball that's pumped up too high. It's got a weak area of the wall, it'll start to bulge a little bit. And ectasia is the worst thing that can happen. The people who are more likely to develop ectasia are people who are young, who are in their early 20s, who have high treatments, more than -6, and who have thin corneas, less than 500 microns. There are 1,000 microns in a millimeter, 500 microns in half a millimeter. The normal cornea is 500 to 580 microns, so if it's under 500 microns, then it's beginning to look like surface PRK rather than LASIK, or maybe another treatment altogether. What I haven't covered is SMILE, which is another form of laser eye surgery, whereby a wedge of intrastromal corneal tissue is removed to also change the shape of the cornea to treat the myopia.
Thanks, Alex. Moving on to side effects. What potential side effects are there to LASIK?
Initially, in the early weeks of recovery, or certainly the first few days, it's normal to get dry eyes and normal to get glare and halos, and this will tend to settle with time. With LASIK, it can settle from days to weeks, although sometimes even months afterwards, people are finding that they're still putting drops or sprays for dry eyes occasionally early in the morning or last thing at night. And for people who have the surface treatment, the glare and the halos can take a lot longer, and some of those people will get dry eyes, particularly at night. So normally in us human beings, we secrete tears during the day, but we don't at night. And sometimes after laser eye surgery, particularly the surface laser PRK, that dryness at night is exacerbated, so that when they're having their REM, their rapid eye movement sleep at 4 or 5 in the morning, the eyeball, instead of moving around in a well-oiled position, is very dry, and it can feel like the eyelid is stuck down to the front of the eye, and that can sometimes rip some of the surface epithelial cells off the cornea can wake up with an uncomfortable eye in the middle of the night thinking you must have accidentally rubbed it. You haven't, it's just the REM sleep which has ripped off some of the epithelial cells. If it doesn't happen during that REM sleep period, sometimes when people first wake up in the morning, they realise they've got to be careful and must massage their eyelid a bit before opening it, because the eyelid can be stuck down to the front of the eyelid again, it's so dry. That settles with time as well, that's not a long-term problem. But certainly teardrops, sprays and even ointments in the eye at night before going to bed can all help alleviate that in the short term until it gets better. A lot of people who wear contact lenses prior to having laser eye surgery do have dry eyes because they have the dry eyes associated with the contact lens, and the contact lens is floating, semi-submerged, and the tear film can cause disturbance to the tear film, give them dry eyes. But when they leave their contact lenses out for a period of time, they find their tear film reorganises itself and they no longer have dry eyes. And certainly after laser eye surgery, people who had dry eyes beforehand often don't have dry eyes in the long term after laser eye surgery because they're no longer wearing the contact lenses, so they don't get the contact lens induced dry eyes. But certainly in the period when it's settling down, they will be having teardrops. Some people ask, will it last forever? And we can't look into the future. All we can do is look at the past and try to predict the future. So if people have had a stable prescription for 3 years, 2 to 3 years, they're over the age of 21 or in some centres over the age of 18, then they're 85% likely to remain stable. But the high prescriptions are more likely to regress. So if you're -7, 8, then you're more likely to perhaps, as the years go by, to get a little bit of regression coming back in, so that in 10, 15 years time after laser eye surgery, you might be -1. In which case, you'd be back in glasses again, and you'd say, well, 15 years ago I had my eyes lasered, but I'm back in glasses again. You wouldn't be -8 again, you'd just be -1. But a lot of people remain stable forever for distance vision, but obviously when they get to the age of 45, the lens inside the eye stop focusing, and then just being human is that you need reading glasses.
Thanks, Alex. How long does the LASIK procedure actually take?
20 minutes. If you were to turn up to a laser centre to have your eyes lasered, you might be in the laser centre for an hour and a half, or 2 hours. You'd only be in the laser room for 20 minutes, and the laser itself takes seconds.
And Alex, how long does it take to recover from LASIK, and what can and can't we do?
For LASIK, you'll be watching telly by the evening. Sometimes the distance vision with LASIK it gets better first, and you find that the reading vision is not quite so good, but then the following day it gets better and it kicks in. People say no swimming. For some centres say 2 weeks, some people say a month. The rationale behind that is that all water, whether it's chlorinated, superoxide, lake water, salt water, seawater, fresh water, drinking water, all has free-living protozoans in it, which can incredibly rarely cause eye infections. But if you do get those eye infections and protozoa, such as acanthamoeba, they are very difficult to treat. So it's just better not to swim certainly for 2 weeks afterwards.
And what about sports or makeup?
Makeup, when the corneal epithelium has healed up and it's healed over, really, you could put makeup on within 3, 4, 5 days. Some centres will say no makeup for a week. Taking makeup off and pressing on the eye can sometimes feel a bit tender, like your eye's being messed around with, but it won't do any harm. It's not going to dislodge the flap. So from a makeup point of view, it's fine after a week or 5 days to get back into makeup again. For sports, fine to do jogging, fine to do, take it easy for the first week. Fine to do weights and normal gym stuff. Obviously, if you're going to be showering, you've got to be very careful not to get the water in the eyes, and certainly not going to be swimming at the gym after your workout. And when it comes down to contact sports, such as football or soccer, where you might get an elbow in the eye, or tennis, where you might get a ball straight into the eye, not for 6 weeks.
Thanks, Alex. So we covered this a little bit earlier, but if you go into a bit more detail about who would actually be a good candidate for laser eye surgery and LASIK?
People who are short-sighted, have astigmatism, some older people who are long-sighted and starting to find that they need reading glasses in their 30s. Sometimes they can all be helped, but the ideal candidate would be somebody who's not highly myopic, because then they might need other kinds of treatment. So people who are up to about -7 will be good for LASIK or PRK.
Thanks. And just expanding on that, who wouldn't be a good candidate for laser eye surgery or LASIK?
High hyperopes, so most laser eye surgeons would probably treat hyperopes, meaning alongside of people who are +1, +2. When it gets to +3 and beyond that, then you'll get fewer surgeons that will be happy treating that. All laser eye surgeons are happy treating myopia and astigmatism, but when it gets to be very short-sighted, -7, -8, then there are other treatments that might be better suited to you. If you were to go along to a laser eye centre to be assessed as to whether you're suitable for laser eye surgery, they would look at your eyes generally to make sure there are no other diseases affecting your eye. So you'd want to have a healthy eye, but most people who've been wearing glasses have had regular optician's checks and they know that they have healthy eyes. So we look at them and don't expect to find anything abnormal. If they were to have cataracts or retinopathies or other diseases, or problem with glaucoma, that might make them no longer suitable for laser eye surgery. Certainly if they had early cataract, then the refractive error can be treated by cataract surgery, so they would not be expected to go ahead with laser eye surgery. Traditionally, people who are pregnant or who are breastfeeding or nursing are thought not to be suitable for laser eye surgery because the hormonal changes can give rise to corneal changes which can change the refraction and change their glasses. Fortunately, this is very rare, and if people come along for laser eye surgery and their prescription has been stable throughout pregnancy and breastfeeding, then there's a good reason to carry on that it is stable, it's unaffected by the hormonal changes, and they're fine for laser eye surgery. But you want to make sure that it wasn't changing at all first, and it was in fact stable.